I was sent this by Miss Mercy Morgan earlier last night, and they're saying that there's a measles outbreak in South Carolina that's accelerating and driving people into quarantine. I'm not gonna go. I don't want to be live too long because I have a lot of stuff to do. We got more snow, and I gotta go shovel, and I want to make sure my wife's car is cleaned off and whatnot. Um, just a lot brewing. You can go look these articles up for yourself. I would. I would go read them. Um, there is also uh, they're saying that this winter could see the most severe flu outbreak in decades in the UK with the H3N2 flu, uh, subclade K. They're calling it flu or the K flu or whatever, for like a nickname for it. Isn't it funny how this looks very similar to COVID, blah, blah, blah. But yeah, so this stuff's going on. You can go look this stuff up for yourself, just showing you, so that way you can go check it out. I don't really have time this morning to read it. Um, there's more stuff about the super flu now, they're calling it deadly super flu. And it's deadly all of a sudden. I think that's funny. Forces more schools to close and triggers hospital restrictions as experts warn of lethal symptoms. Um, cases are climbing in more than 3 dozen states. They are on track to overshadow last year's particularly severe flu season. Detroit Medical Center has restricted visitor access to protect patients and staff from the spreading virus. So isn't that funny? So you can't visit your family anymore in Detroit Medical Center. New guidelines limit guest numbers, visitors under 12, and anyone 13 and up who is currently sick. Hospital staff and visitors in New Jersey and New York hospitals were reinstated. Masking requirements, sorry. I mean, it seems to be spreading, at least the fear of it, getting worse. Um, again, here's the ominous new K flu variant is spreading as shot rates fall. And so they want to make this seem like, dude, we can't stop this. There's no, jabby jabby for this. Um, yeah, of course they're not getting their annual flu shots this year. We all know why. Um, uh, so give me a moment here. In June 2024, at the 77th World Health Assembly in Geneva, all 194 World Health Organization member states adopted a package of amendments to the 2005 IHR by consensus. These entered into force on September 19th, 2025, so just recently. After the required waiting period, the IHR are a legally binding framework for managing public health emergencies of international concern, PHEICs, public health emergencies of international concern, PHEICs, like pandemics. Countries must now build and maintain core capacities not just for detection and response, but also for equitable access to health products like vaccines and testing and diagnostics. This includes financing mechanisms and technology transfer to developing nations. So they want to make sure that this time everything's more widespread. And let me mind you, even in places like, uh, oh man, I forget the place. It's over there by Australia. They're the ones that like have like vaccine mandates legalized now to where they can like forcibly vaccinate you. Oh, I forget the name. New Zealand. New Zealand. Goodness gracious. It says here each country must designate a national IHR focal point and now a national IHR authority to coordinate with the World Health Organization, ensuring faster information sharing and compliance. Oh, doesn't that sound good? And this is what you're going to notice a lot coming up is just they're saying there's a new emphasis on equity and pandemic response, including a coordinating financial mechanism to support low-income countries. This could involve reallocating resources globally, which means taking money from one country and giving it to another. Enhanced early warning systems, including for pandemic emergencies, allowing the World Health Organization Director General to declare threats more proactively. I'll tell you, something's brewing here, and it doesn't look good. And I don't know what's real and what's not. I'm not going to get into that. I'm not going to speculate. Every conspiracy theorist has their side. Every citizen of America and countries elsewhere has their opinion, okay, on as to how these things are coming about. But I'm trying to show you the end game here. Goodness, a little hoarse this morning. Trying to show you the end game here. Um, the amendment stressed that recommendations are non-binding and states retain decision-making power. However, there's criticism that they could enable, here we go, the World Health Organization to, and I'm using my rabbit ears here, recommend measures like lockdowns or travel bans with stronger enforcement teeth through reporting obligations. Factually, these build on the 2005 IHR, which were already used during COVID-19 for global alerts, but the updates address lessons learned from that pandemic, like inequities in vaccine distribution. So when it comes to equity, they're meaning vaccine distribution. There it is. There it is. There it is. On May 20th, 2025, at the 78th WHA, member states unanimously adopted the Pandemic Agreement, a new legally binding treaty. And this isn't the peace treaty, my gosh. Okay, for those of you that immediately jump to that, aimed at preventing, preparing for, and responding to pandemics. Negotiations began in 2021 and it's separate from but complementary to the IHR amendments that just recently took place. It will enter into force 1 month after 60 countries ratify it. Status as of December 2025. There are ongoing ratifications with countries like the US holding out in earlier drafts, though final adoption was broad. So, we're all in it now. Countries are agreeing to share genetic data on pathogens quickly with benefits for vaccines to be redistributed equitably. There it is again. Anytime they're talking about equitably, this is meaning vaccines. This creates a global database for surveillance. Oh, isn't that cute? I wonder if the data ID and your digital data ID is going to be implemented here. I wonder that's how they're going to sell it to you. I mean, I don't know if any of you have seen like um, Freedom to Fascism, where Aaron Russo talked about how they're going to use the medical system to implement a tracking system, and a chip. Eventually, it'll come down to that. And it reminds me of the movie Stephen King's The Stand. I don't like Stephen King at all, but that is some predictive programming, let me tell you. And not only do they have an older version, but they have a new like 10 episode version that they made where they have like a series that they came out with, and it is not Christian at all. Watch with caution. And there is even some, you know, I don't want to get speculate what's in the show, but it's all about a sickness that brings about the rise of the Antichrist. And when COVID-19 happened, they asked Stephen King, they said, "Oh, hey, is this the Captain Trips, which was the sickness in the stand?" They asked him, is this it? You know, is this Captain Trips? Is COVID-19 Captain Trips?" And he says, "No, no." So that's interesting. Um, and the One Health approach integrates human, animal, and environmental health monitoring, potentially justifying interventions. We all know what that means. In agriculture, wildlife, and climate policies. That means they're going to come slaughter your animals like they did those poor ostriches in Canada. They can just come kill your herd whenever they want, come kill your flock whenever they want, and shut anything down because of the climate policies, right? Locking down whenever they want, establishing funds and mechanisms for R&D, technology transfer, and supply chains. And the World Health Organization is gaining a bigger role in coordinating global responses. They're getting more power, they're getting more of an upper hand. The equity focus, here's equity again, aims to prevent vaccine nationalism, ensuring fair access, framed as a victory for multilateralism. And so that means that their victory over the world through their vaccines. It's about cooperation, not mandates. Aha. But it includes provisions for monitoring compliance and resolving disputes. Resolving disputes would be like, maybe that uprising that's coming when people say, "Oh hell no," right? I wonder if that's what the resolving disputes means. And monitoring compliance is censorship. And I have been talking about the censorship coming in the next pandemic for years. Okay, for years. I have been talking about these things coming for probably the past 2 or 3 years, saying there will be a second lockdown. There will be, another situation that will come about. This is I've this I've been trying to warn people for a while that this is coming, and it's not about how we get there. It's about the end game. It's about the end game. And that's the thing is I don't want you to fear any sickness because honestly, Psalms 91. Enough said, right? Psalms 91. But the thing is, it's about the end game and where we're going as a global unit and what they're funneling us towards. Um, Give me a moment here. To me, this smells like a power grab, you know. So disguised as equity, there's the equity again, and cooperation, the IHR amendments and pandemic agreement create a web of obligations, surveillance, data sharing, resource redistribution that could normalize global oversight. During the next pandemic, the World Health Organization could declare a PHEIC, triggering recommendations that nations feel pressured to follow lest they face isolation or funding cuts. Isn't that interesting? Because this basically puts the world's economy into the World Health Organization's hands and the World Economic Forum's hands. It's almost like a redistribution of power, if you ask me. The One Health, all right, there's that one, like one world order, the One Health integration ties health to climate. Isn't that funny? Because that's how that's climate lockdowns, blah, blah, blah. We've talked about on this channel before. Agenda 2030's goal 13 out of their 17 goals, allowing emergencies to justify controls on farming. And there's where I talked about earlier in this that, they're going to want to go after your herd or your flock. Travel, all right, they're going to tell you you can go or you can't go anywhere, or even digital IDs for tracking health risks. World Economic Forum's fingerprints are everywhere. The Great Reset rhetoric during COVID-19 framed crisis as opportunities for systemic change, aligning with the New World Order theories that of elite orchestrated control that are out there on the internet. Agenda 2030's universal health coverage. There's that universal or global one health, universal health coverage pushes for centralized systems, potentially leading to mandatory vaccines or biosecurity measures, which is, under the guise of sustainability. All right, because they want to sustain the globe, right? Because that's what they care about. They care about you and they care about me, right? They care about you enough to give you a vaccine, even though they won't give you, say your diabetes medication for free, or any of this stuff that people need, blood pressure medication or just whatever. Okay, they really care about us. Oh man, they really care about us. All right. With lots of sicknesses brewing, e.g., ongoing reports of emerging variants of zoonotic threats, this setup could accelerate. A new outbreak can trigger global lockdowns, supply chain interventions, and wealth transfers. You see, the wealth transfers is because now they'll have control over the economy. Isn't that funny? How instantly the power gets taken from the countries, taken from the states, or whatever the uh, or states or providences, whatever. So they're taking our freedoms from us with this thing. Eroding borders and sovereignties. Critics see this as a neoliberal meta governance. Yeah, it is. Oh, yeah, it is. This is meta governance for sure. Transforming states into enforcers of elite agendas. Um, these aren't isolated reforms, but building blocks for a world where health becomes the pretext for total coordination, fulfilling visions of a unified global order by the year 2030. So, in Missouri, multiple schools are closed, including Villa Duchess Catholic School in St. Louis, due to super flu outbreaks with high illness rates among students and staff. Now we're getting into, what's happening across the U.S. right now. In Iowa, schools in various districts shuttered for deep cleaning amid surging H3N2 cases. In Texas, and listen to this here. This is going to be pretty interesting. Wait, hold on. So, this is going to be pretty interesting what you're about to hear. Widespread closures in districts like Houston and Dallas, Fort Worth areas, part of at least 10 states affected with entire, here's the key here, and tell me if this sounds familiar, everybody. Come on now. With entire districts switching to remote learning. Ah, here's where the rubber meets the road. Measles outbreaks here, 198 cases, likely higher now, has led to targeted quarantines in schools. In Ohio, hold on, let me get a drink of water here. Sorry, it's early morning for me. In Ohio, school districts in Cleveland and Cincinnati regions closed or went remote learning due to flu surges. This sounds so familiar. Told you. I don't usually go into that. I don't usually get like that, but I told you so. Closure in Oklahoma, closures reported in Tulsa and Oklahoma City schools for illness spikes. In Georgia, Atlanta area schools are affected with closures tied to H3N2. In Virginia, districts in Richmond and Northern Virginia closed amid H3N2 flu waves. In Louisiana, a second surge of flu led to remote learning switches in Baton Rouge and New Orleans schools. Broader flu activity is high in over 3 dozen states. That's over 36 states: California, New York, Illinois, Florida. But there's just the specific closures are scattered because it's by area, but everybody is stepping in line. Be a good little bootlicker and step in line. For measles, Chicago, Illinois reported new case in September 2025, nearing 1,500 total U.S. cases, prompting school exclusions for unvaccinated kids. That's where they force, the stuff on your children. Uh, in New Mexico, there's measles cases, and there's also Texas cases as well with potential school impacts that are coming. There's not a nationwide school shutdown yet, where there's a mandate. Decisions are local. All right. So, just putting that out there. And in New Jersey, like these are for the mask mandates that are happening. I looked all this up. In New Jersey, major systems like RWJ, Barnabas Health, and Hackensack, Meridian reimposed masks, all staff, patients, and visitors statewide, citing flu and RSV spikes. New York hospitals in New York City and upstate, uh, NYU, Langone, and Mount Sinai reinstated mandates in patient areas, and the maps are showing broad returns of mask mandates in that area. California, facilities in Los Angeles, San Francisco, and statewide, Kaiser Permanent require masks in high risk zones like ERs and oncology. In Washington State, hospitals or Puget Sound Hospitals, which is Seattle's UW Medicine, updated guidelines for 2025 to 2026 season, mandating masks in clinics and hospitals during this time. Other areas, at least 4 states, including Illinois, Massachusetts, reinstated in early 2024, patterns continuing into 2025. So these things were already happening in these states. General mandates persist in healthcare nationwide. But again, it's all up to the state itself. But all of the states are stepping in line. Um, Beneath the surface, sickness is brewing. It's all lining eerily with predictive simulations, and we've talked about this, suggesting orchestrated preparation for control, like Event 201 from Johns Hopkins in October 2019. And I've talked about this. Stimulated a coronavirus pandemic just before COVID, focusing on global coordination and misinformation. And oh man, we remember the censorship. And again, I have talked about censorship coming during a pandemic for a few years now. Okay. It's not something recent that I've been talking about. Simulated a coronavirus pandemic just before COVID, focusing on global coordination and misinformation, mirroring real events. Now, exercise Pegasus in the UK, ending in November 2025, was the largest, or actually even just recently, it went as far as just recently because there was 20 schools that were locked down, lights turned off. They were literally went on lockdown. Kids were told to go under their desks. It was insane. I guess it terrified the crap out of the students. But it was the largest UK pandemic simulation in history, testing responses to a fictional enterovirus EBD68 outbreak, including school closures, national lockdowns, travel bans, and protests over social distancing. They're expecting the uprising this time. They can't wait for you to uprise. That just gives them more power. But they'll take that power anyways, even if you don't uprise. So, I mean, do as you will. It involved every government department, Cobra activation, and local forums, concluding last month with lessons for 2026, just as H3N2 surges across the UK. And I showed you that. Again, I've been talking about this document for the past 2 years, SPARS Pandemic 2025 to 2028 by Johns Hopkins, is a futuristic scenario for a novel coronavirus, SPARS CoV from 2025 onward, emphasizing communication strategies for vaccines, mandates, and public resistance. Exactly the timeline we're in now. This seems like a rehearsal for countermeasures. I don't think it's a plan, everybody. I really don't. But it's including equity. There's that word equity again. And distribution, echoing the World Health Organization's new pandemic agreement. So this is where it's all heading. Give me a moment here. Let me get another drink. Hold on. I got to end this pretty soon because I got to get out and start shoveling. I'm just trying to give you the facts here. There's quite a bit more here. Based on recent reports as of December 11th, 2025, China is indeed facing significant surges in respiratory illnesses that are overwhelming hospitals across multiple provinces. This includes a mix of seasonal viruses like influenza, a H3N2 subtype, your K flu. They got K-pop, now they got K flu. Sorry. Human metapneumovirus, HMPV, mycoplasma pneumoniae, and possibly lingering COVID-19 cases, leading to overcrowded emergency rooms, pediatric wards, and outpatient clinics. The outbreak has been building since late October to November, so this has been brewing for a while in China, with a rapid increase in cases entering a high epidemic level in at least 17 provinces. And this is when they hit you with the lockdown because it's straining healthcare. Now, straining healthcare resources and prompting expanded monitoring by authorities. There's your crackdown, right? So it begins. Official statements from the Chinese Center for Disease Control and Prevention and the National Health Commission describe it as a epidemic with major viral or without major viral mutations at this time. I think that's right around the corner. That's just my opinion. It seems that, with everything going on, this is kind of what they want. Um, uh, this is framed as a harsh flu season amplified by post COVID immunity gaps and cold weather. So they're saying, because of people don't have their immunities built up and because of cold weather, this is going to be a harsh flu season. But if you look beneath the surface, it's suspiciously timed with the rollout of the World Health Organization's amended IHR and pandemic agreement. This is not the peace treaty that the Antichrist will make a covenant with many. It is not. Okay. For those of you who jump right to that, once again, tools for equitable global responses. We all know that means vaccine responses that could justify interventions under One Health frameworks. You get that One Health? With China's history of opacity, remember early COVID denials, these seasonal surges feel like a test run for Agenda 2030's universal health goals, where outbreaks in one nation trigger international mechanisms eroding sovereignty through data sharing and resource mandates. Social media leaks of chaos combined with official downplaying mirror event 201's misinformation scenarios. That war game scenario that predicted and showed that the COVID-19 pandemic was all planned. Potentially priming for vaccine pushes, equitable, right? Or digital surveillance tied to sustainability agendas. If this spreads like H3N2 to the West, as it's already doing, watch for the World Health Organization declarations activating those new treaties. I'm telling you, it's coming. It's coming. Buckle up, Buttercup. The world's about to be a different place. We're not in Kansas anymore. Watch for the World Health Organization's declarations activating those new treaties, another step towards a centralized new world order where health crises, quote, consolidate power in elite hands. The cracks in China's system, economic woes, and military purges, because it's just complete upheaval over there, might even be forcing this as a distraction or desperation play. Something's aligning too perfectly here, people. I'm telling you, something is aligning too perfectly. Give me a moment here. Looking through this here. Give me a second. Trying to look through this because I don't want to just sit here and read a whole bunch of mumbo jumbo. just kind of emphasizing, I was looking into this. They're absolutely making remote learning. There's a comeback in some U.S. states and school districts. They say it's to flatten the curve. It's only for 2 weeks to flatten the curve. Only for 2 weeks to flatten the curve. Uh, like I said, in South Carolina, they're implementing remote learning. In Minnesota, they're implementing remote learning. In Texas, in Ohio, Oklahoma, Georgia, Virginia. Um, Give me a second here. All right, so give me a second because this one's important. Hold on. I want to get to the right point here because I don't want to sit here and waste my breath. There is no fixed tipping point or official numerical threshold for declaring national policies. This is important. Pay attention, everybody. Pay real close attention to what I'm about to read to you. There's no fixed tipping point or official number threshold for declaring national policies like widespread remote learning or lockdowns. These are discretionary because, everybody's already stepping in line. Multiple states are already stepping in line. They're already down on their knees, licking the boots of the government. Based on qualitative and quantitative public health data and decided at state, local levels, they'll fall in line. Trust me. And decided at state, local levels with federal guidance. That means the World Health Organization stepping in and, oh, we recommend you fall in line. The how much is needed varies by jurisdiction and pathogen, but key triggers include overwhelmed healthcare systems, okay, hospitalization rates nearing capacity, 80% ICU beds occupied can trigger that in your area. California lockdown when hospitalization spiked and cases rates exceeded 100 people per 100,000 population. So it didn't take very much for California to lock down. Okay, so understand that. Okay, uh, it can also rapid transmission can be a cause. An effective reproduction number indicating exponential growth combined with rising cases can cause a lockdown in your area. Vulnerable populations impacted, high illness, death rates in children or elderly, or variants evading vaccines like the H3N2. Okay, we're getting somewhere here. Prompting uh, school specific measures, which we're already seeing. We're already seeing that. We're already seeing them get on their knees and lick the boots of the World Health Organization and the government. And remember, Bill Gates just met with Trump not too long ago before this all starts going down. And economic or political pressure, public opinion, economic fallout, or federal incentives, e.g., via PrEP Act declarations, can accelerate decisions. So overwhelmed healthcare systems, rapid transmission, vulnerable populations impacted, or economical or political pressure, which we know is happening behind the scenes, okay, can cause a lockdown in your area. Okay. Now, and I find it funny. It's so indicative of what we've been talking about for so long and what I've been warning is coming, and even the dreams that I felt the Lord has shown me. I'm not going to say, "Thus saith the Lord," but I felt it was from the Lord. It did. Historically, and so this we're looking back here during COVID-19 lockdowns, they began in March 2020 with relatively low absolute numbers, e.g., 4,000 US cases is all it took with 70 deaths nationwide. But high growth rates by April with 30,000 daily cases and 2,000 deaths, most states had stay at home orders. It didn't take much, is what I'm trying to say. States with stricter measures, like New York, had thresholds like positivity rates 9% or hospitalizations 3,000 daily for reopenings, but no uniform call it point. So what it's saying is that there's not like any set number of sicknesses or set number of deaths that can trigger a lockdown. This is all discretion. And when they decide it's time for you to go under their thumb, they will do so. They will do so. And it looks like that's where we're heading. Now you're going to know it's going down when state of emergency declarations start to happen by governors or local officials, invoking public health powers to restrict gatherings, close businesses, schools, and mandate quarantines. Well, I'm sorry, but the schools are already getting closed, and mandates for quarantines are already happening. I've already shown you, and I'll show you the news clips after I talk about this. But federally, the president can declare a national emergency under the National Emergencies Act, the NEA, or Stafford Act for aid, but this doesn't directly impose lockdowns. States handle implementation. So it'll be your state that decides whether you go under the cuff and the key. Now, I'm going to show something real quick if I can find it. I hope I can find it. Yeah, I think this is it. Yeah, right here. So, I mean, first off, look at the cake. Okay. The 250th anniversary of America. You know, in 2026, it's already the 250th year of anniversary of America. And it shows the cuff around the wrist, but it shows resistance. Okay. So I think a lot of chaos is about to come to America. And I think that right here, they got two vaccines, and then they got robots delivering packages. I mean, this is all indicative economic crash. I mean, it's all right here. Global war. I mean, I think 2026 is the year. Yep, exactly, John Paul. No bootlicking, no funds. Exactly. That's exactly what it is. And so, I mean, this is they're literally telling us what's about to happen. And I hope people are listening. You know, I remember there is Christian communities out there that told you that the rapture has to happen in 2025 or the math doesn't make sense. Well, their math doesn't make sense. God's math makes sense. But I remember that. I remember people saying that. If the pre-tribulation rapture doesn't happen in 2025, the math doesn't make sense. Well, I'm sorry. God's about to allow some things, I think, to bring people to their knees and to bring them back to God. Honestly, I really do. And I think that the churches are going to fill. During the first pandemic, I remember after my mom passed away, right now, actually, I went to the church to prepare for her like memorial service, just to have a little gathering of people that knew her. And most people didn't show up, and it's funny, there was a whole bunch of people that watched it live because the church broadcast it live, which I appreciate. I was able to record it and have that for my own files, you know. And but it was crazy because the pastor looked at me and he says, "This isn't a church dying under a pandemic. This is a church that's thriving under a pandemic." Because the real churches that step up to the plate and don't cower to a system that wants you to get down on their knees and lick their boots, all right, those churches are gonna just explode. And I'm telling you, God's allowing a shaking. God is allowing a shaking. I truly believe it. All right. And I know it's not what you want to hear, but it's what you need to hear. Jesus is coming soon. Absolutely. I believe it 110%. I'm a firm Christian. I firmly believe in a pre tribulation rapture. I don't care who thinks I'm crazy to believe in those things. I am crazy for Jesus. I'll tell you that right now. But it does not mean that what you're seeing right now isn't coming to your doorstep. And I've been telling you, I've been warning you, I've been saying, heads up, heads up, heads up. And I'll show you just real quick, go through it one more time. Miss Mercy Morgan sent me this one last night, and I appreciate you, sister. She's always on the lookout, and she knows what news I'm looking for. People send me news all the time, and it has nothing to do with what, is really going on, in my opinion, most of the time. I don't get time to watch every video or read every news article that's sent to me. But they're saying that a measles outbreak is accelerating, driving hundreds into quarantine. And remember, I told you about quarantine, right? And all the information I just read to you, and how they can implement a lockdown, what it takes for them to implement a lockdown, and those are the facts. All right, what I'm sharing today with you is the absolute 110% facts. And now in the UK, because just like exercise Pegasus, they got this new flu strain, and they're saying that they're warning that this winter could see the most severe flu outbreak in decades. Whether it's real or not, I don't know. I can't tell you, but it's about the end game. It is about the end game. It is about where they are taking us as a society. All right. School closures all over the place, remote learning reinstated, mask mandates reinstated. Does this sound familiar? Multiple states, over 36 states, are getting involved with this and are seeing measures implemented in certain areas. I'm sorry, but this isn't looking good. And people better start praying. People better start praying. They're saying deadly superflu forces more schools to close and triggers hospital restrictions. And I want to say that, and I'm going to read this for a minute. More hospitals and schools across the U.S. are imposing renewed visitor restrictions and closures amid concerning spikes in a deadly superflu, as experts urge the public to keep watch for warning signs. So they're literally visitor restrictions. Like, you ain't going to be able to see your family again. That's that kind of crap coming back about. I remember when people had to go to the nursing home to see their family and look through the window from the outside, like their parent or their grandparent is like a gerbil in a cage. This is what I went through during the first pandemic. They wouldn't allow me to see my mother until she was close to dying. Don't ever forget what they did to the elderly. Don't ever forget what they did the first time. Don't think it's going to be easy this time either. I really hope people are ready for what's about to happen, and they need to be praying and watching rather than thinking, "Oh, God Himself couldn't sink this ship." And I've dubbed it Titanic syndrome. I kind of made that up myself. That where Americans, especially Americans, they walk around so haughty, stiff-necked, and proud, and stubborn to the idea that these things can take place, and when they finally start to, then they can't take it. And then I have to leave social media. I can't take it. It's so horrible. I can't watch it anymore. Well, I'm sorry, but if you would have believed in the first place that this could be coming, then it wouldn't be such a shock. It wouldn't be such a shock. And I'm not making fun of people here. I'm honestly frustrated because I have spent so many countless hours, probably hundreds of hours, warning people about the possibilities of what is coming. And again, you know, and these are all newer articles. These are all newer articles. And they're saying that this new K flu, the H3N2, isn't getting covered by the vaccines. And I told you just a moment ago, and let me see if I can find it. Give me a moment here. That part of right here, okay, I remember I said 4 different reasons why they can lock you down. Overwhelmed healthcare systems, which is already beginning to happen, especially in China. I already proved that to you. Rapid transmission, so people getting sick quickly, which is happening. Vulnerable populations impacted, like health, death rates in children or elderly, or variants evading vaccines. Variants evading vaccines is a reason that they can lock you down. And look at this article. But there's other this isn't the right article, but there's other articles talking about how this H3N2 isn't getting hit, by vaccines. Like the vaccines aren't covering it. Of course. Of course. Let me see something here. I'm going to try to look something up real quick. Give me a moment. Hold on. I'm just doing a quick search because I want to be accurate in what I'm telling you guys. My computer is very slow. Yeah, so they're saying basically that it doesn't really cover the H3N2 strain, which is the K flu, but it still is designed to protect against other common influenza. So, yeah, I just wanted to be, yeah. So, I mean, it was a decently accurate statement. There's some articles that say yes, there's some articles that say no, but it seems that they're leading us towards something that is going to put more power into their hands. And the biggest part of it is that they war gamed this out, and I'll show it real quick. I'm not going to go into it, but they war gamed back in 2019 event 201 before it happened, and then they war gamed whatever is going down right now in 2025 to 2028 as far as pandemic scenario. Both John Hopkins. If you look in the lower left corner here, that's Johns Hopkins logo, World Economic Forum, Bill and Melinda Gates Foundation, and all the same people are part of this. The Johns Hopkins Center for Health Security, right at the bottom. So, I mean, these are the people that brought you the COVID-19 pandemic. And, so I don't know. I don't know. I don't know if this is going to be what they're saying it is, but it's looking like it to me. Couple of different vaccines on the bottom of the soccer ball. When is the World Cup, by the way, for soccer? Does anybody know? Can anybody throw that in the live chat for me, just off the top of their head? But all of this seems to be going on, or seems to be like it's coming, and like this is going to be going on, and it's got that 250-year anniversary cake, for America, and then you got a handcuff on. Is that the lockdown? Are they telling you they're going to lock you down? And then there's the fist is resistance. Obviously, it's always, symbolized resistance or revolution. The robot delivering packages underneath the tank to the left. There's a red tank on the left. If you look underneath it, there's a robot carrying a package. And then if you look on the top of the soccer ball, there's drones with the string attached. And when they have packages, they drop them with strings usually, and they'll lower them down into a backyard or something like that, and they got multiple drones with strings attached all the way surrounding this. And I think they're going to use these robot dogs to police areas. I really do. This is a kickoff. This is I think 2026 is the year it really happens. I really do. And I mean, I've been watching for a while, and it seems like everything's kind of leading up to like a lockdown implementation. Like I just watch for the spoon feeding. Watch for the spoon feeding. Watch them declaring health emergencies now. That's what's next. That's what's next on their agenda. All right. That's what's next on their agenda. So I love you all. May God bless you. May God keep you. And please don't forget to go out and change this world in which you live, and make sure that you are praying and that you are watching. All right. Most people just watch a YouTuber, tell them what to think. But I'm asking people to get into their prayer closet and to get on their knees, and instead of bootlicking, start calling out to the King, the creator of the heavens and the universe, and his Holy Spirit for guidance as to how to deal with what's coming next. All right. Love you guys.
Yeah.